Hello everyone, welcome to the New York City CBT Association lecture series. My name is Nathan Thoma. I'm the president-elect of NYC CBT, and I am here to introduce Art Freeman, who will be giving tonight's lecture. Dr. Arthur Freeman is professor in the Department of Behavioral Science at Touro College, where he is also the director of the school's graduate program in psychology. He holds graduate degrees in science and education from New York University and Columbia University, respectively, and he earned the Doctor of Science degree from Babis Balyai University. He is past president of both the Association for Behavioral and Cognitive Therapies and the International Association for Cognitive Psychotherapy. He is a distinguished founding fellow of the Academy of Cognitive Therapy, a fellow of the Association for Behavioral and Cognitive Therapies, and a fellow of the American Psychological Association. In addition to well over 100 journal articles and book chapters, Dr. Freeman has published over 75 professional books. That's a lot of books, I have to say, including work translated from English into 14 other languages. Dr. Freeman has been a consistent leader in the application of CBT to the treatment of personality disorders. We are deeply honored to have him here this evening to speak on the topic of narcissistic personality disorder. So, Dr. Freeman?
Just to be clear, this person lives in Forest Hills. Big white house on the corner, right by the tennis stadium. Thank you for inviting me. I often start by saying I'm very pleased to be here. I'm especially pleased to be here because I have recently moved back to New York after being away for many years. I grew up in the Bronx, and I moved back to the Bronx. And you can take a boy out of the Bronx, but I'm told you can't take the Bronx out of the boy. So when I was living in Chicago, people would try to be kind and say to me, "You know, Art, you're so Eastern." "You mean New York?" And I'd say, "Yeah, that." So I'm especially pleased to be here. I have far more material than we have in an hour and a half. So if you would like a set of the slides, write to Lindsay. I'll forward her a set of the slides, and she'll give you the whole slide set. As long as you promise not to start doing workshops with my slide set and put me out of business, because I depend on this to pay my rent. Now, here's a question to start with. Is narcissism a genetic predisposition? Pack animals, like people, have an alpha animal. It could be male or female, but have an alpha. And the alpha gets, choice of sleeping accommodations, choice of mate, choice of food. So maybe being the special one in the pack is a genetic predisposition. So that's something to think about. And someday we'll find, markers for these things. Now, I know what it would look like. This would be the one chromosome that's bigger than all the others, and you know where to look. Is it adaptive? Is there good narcissism? Can it be functional? Is it gender related? Is it developmentally related? I had a call several weeks ago. A director of an adolescent treatment facility said, "We'd like to invite you here to do a one-day presentation." I said, "Oh, okay. Where are you located?" They told me. I said, "All right." "When?" I said, "Yeah, that day's open." "What topic would you like?" So we'd like you to talk about treating narcissism in adolescence. I said, "I can't do it. It's developmentally appropriate. Young, toddlers and adolescents are narcissistic. It comes with the territory. So no, I'm not going to come and talk about doing something that's quite impossible." Is it age-related? Is it a cultural characteristic? And I'll talk more about that. I went through the literature, went through a number of books and papers on narcissism. I found all of these terms: self-loving, selfish, excessive admiration, lack of humility, an infantile developmental stage, erotic self-love, lack of empathy, uncaring for others, vain, self-absorbed, egotistical, conceited. Doesn't sound very nice. This is like a bad thing. And when you ask about the guy in Forest Hills and Big White House, when I lecture out of the country, people in South America and Europe ask that question. Is your president a narcissist? And contrary to what some people are saying, it's against the code of ethics to come up with a diagnosis for someone that I've never examined. So, does he have any of these characteristics? Maybe. How about someone with very positive self-esteem? Would you accept that in lieu of the term narcissistic? Do you like that? They have very positive self-esteem. How many people like that? One. But basically, we have a problem. Can anyone think of positive synonyms for narcissism? Well, we have a couple. Someone is special or gifted. Anyone think of any others? A leader, okay.
Confident?
But not just, no. If you say to a narcissist, you're competent,
No, confident.
they'll kill you.
Confident with an F.
Confident?
Yes.
Almost. But we're hard pressed. So we start off with an issue. Charming. Well, a lot of people are charming. That doesn't make them a narcissist. They make them histrionic. They're very charming. But the problem we have is we start off with a given. Narcissism is bad. It's negative. We might question that. I had a phone call. Dr. Freeman, I might want to see you for therapy. Okay? Who referred you? I'd rather not say. Okay, what's your name? Alicia. Alicia what? I'd rather not say. What reason would you be seeking therapy? She said, I'd rather not say. How can I help you? I'd rather not say at this point. I said, then what are we talking about? She said, I have some questions. Ah, okay. She wants to ask about insurance, my background, my experience. Sure. What are your questions? Okay, question number one. Who wrote Ein kleiner Nachmusik? That's what I said. Huh? Let me repeat. Who wrote Ein kleiner Nachmusik? Now, I must say, I do know the answer to that. I said, I'm sorry, I don't understand the reason. You're asking me that. She said, I'll take your lack of response to indicate that you don't know. Second question. What is the current name of the country formerly known as Burma? I read about that in the paper. I said, who is this? Denise, is that you? Come on. What is the current name of the country formerly known as Burma? I'll take your lack of response to indicate you don't know. Third question. I said, this is a huge waste of my time. Third question. Who painted the screen? I knew that one too. I said, I'm hanging up. I'll take your lack of response to indicate that you don't know. She said the answers are Mozart, Myanmar and Munk. I said, what was the purpose of this? And she said, I'm incredibly smart. And I need a therapist who's smart. And you're clearly not the one. Now, what does this prove? To me, this was incontrovertible evidence that there is a God. Because now I'll never have to see her. And deal with her on a weekly basis. And be angry a lot. And she hung up. That was it. And the actual call took less time than it took my telling about it. But for many individuals, their narcissism is so obvious, it's hard to miss. It bites you on the butt. For others, it's not that clear. And we have to do some searching. If we look at it from a cognitive behavioral perspective, two of the main distortions that we see in narcissists are selective abstraction. If you remember that you have a body of data and you selectively abstract from that data only certain of the data that show that you're brilliant, wonderful, phenomenal, and the idea of all or nothing thinking. They dichotomize the world. It's black or white, night or day. If you're not the most brilliant, then what are you? The world's biggest loser. So they dichotomize, and they constantly scan the environment for evidence of their superiority. If they find evidence and someone says, you did a good job. No, really, how did I do? A solid average performance. They're suicidal. No, I'm not average. And this year, I'm very proud to say, is my 50th year of university teaching. And in that time, I've had all kinds of experiences. Dr. Fishman is here, and he remembers the good old days back in Philadelphia, the Center for Cognitive Therapy. We would get referrals from the law school. That Dr. Beck's wife was the associate dean, and she would send us patients. And who were these patients? They were law students at Penn Law. Now, to get into to be one of the 106 law students at Penn, what did your undergraduate record have to look like? Average? Solid C's? B's? You were number one in your class at Swarthmore, Penn, good places. And now, here they were among 105 other law students, and they were number 3 in the class and are suicidal. And in fact, some were homicidal. They wanted to kill off the other 2. Literally. Talking about how to get them. When they're told that they're okay, they respond with anger, anxiety, or overcompensation. And if they have poor problem-solving ability, limited reality testing, and lack of empathy, it makes it even worse, much harder to treat. Any indication that others are better than they are. They're not the best of the best of the best of the best. They're average. They are, in fact, maybe even less than others. They will do everything they can to destroy that offending view. They will say to you, am I the most interesting patient you've ever had? What do you say? Well, you fall back on a classic psychoanalytic technique. You go, uh-huh. We give them silence. And what do you say to them? Now, part of the difficulty is that they're often skill deficient. No one's ever taught them the skill of empathy. Anybody have 2 kids or more? You got 2 kids, how old? Okay, I want you to think way, 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 way back. 31 and 28, they're 3 years apart. So think back to when one was 5, make it 6, the other was 3. Did you ever say to one or the other, would you like it if your brother or sister did that to your toys? You know, how would you like it? You teach them empathy. For many of the people we see with narcissistic style, they've never learned empathy. Now the good news is, as a psychoeducational approach, CBT, we can teach empathy. That basically, none of us can be fully empathic with our patients. That they have experiences that we've never experienced and don't want to. I had a schizophrenic patient say to me, have you ever had to pull your dinner out of a dumpster? No. Then how do you know what I've had to go through? The denigration of eating rotten food. But we need to teach them empathy. Now what's interesting, and this is touted as something new in DSM-5, it's dimensional rather than just categorical. But Beck has talked about the continuity hypothesis forever. You know, from sad to depressed. It's a continuum. So some people are very mild, and it's a style, not a disorder. It only becomes a disorder when it's maladaptive, it doesn't work. But many people have a narcissistic style. Usually, it doesn't interfere with success, adaptation, or functioning. And when it does, it's often limited. Someone says, you know, get off your high horse. Stop screwing around. Or it may be moderate and at times cause conflict. Or it may be severe. The problem is the mild narcissists don't come for therapy. So what we're left with are the moderate to chronic that are always in conflict and always unsatisfied with their lives. So we get a very a poor version of narcissism. You know, these are people we marry, these are people we're friends with. And once again, we look at a continuum. At one end is the altruist, the other end is the narcissist. And none of us is fully altruistic. Now, there are people who are altruistic. I remember my grandmother would come to our house in the Bronx many years ago, and she would say to me, play the song. And there was one record we had that I'd play over and over again. And she would just sit there and cry. Anyone know what the song was? It's called My Yiddish Mama, My Jewish Mother. And in it, the song, it was by Sophie Tucker. It says, in water and fire would she run for her children. Oh, she was a true altruist. She'd risk her own life. You know, if there was food, the children got it. You know, for me, water is fine. So we need to look at narcissism as a continuum. Now, many patients come into therapy saying, my problem is low self-esteem. How do you raise someone's self-esteem? What I would contend is, you know, how much self-esteem do you need? If you have too much, now you're a narcissist. That self-esteem is a process, not an endpoint. Okay, you have adequate self-esteem. That narcissism, interestingly, seems to be more of an endpoint than a process, though it has elements of both. But self-esteem is something you go through on a day-to-day basis. What will you think of me if? Now what's interesting, the object relations people, the Adlerians, psychodynamic folks, see narcissism as compensatory. Adler talked about the so-called superiority complex. I don't think I'm inferior, I think I'm better. But this is a compensation. So the idea for many individuals, many therapists, is that the narcissist feels so little, so unachieving, that they have to blow themselves up to the size of a Macy's Day Parade balloon to feel good, to compensate for feeling little. Now, for some individuals, this is true, that the narcissism is compensatory. But for others, they're good at what they do. And maybe they've always been good at what they do. They have a different set of rules. Basic rule. You may have learned the meek shall inherit the earth. They don't buy it. You don't blow your own horn. Why not? You don't call attention to yourself. Now, for some individuals, that's true. But one of my basic schema is the importance of being noticed. I think it's really important. I like to get noticed. So when people say to me, gee, you've published so many books, how do you do that? Well, I discovered something years ago. I'll share this. When you publish a book, they put your name on every copy. So if you want to get noticed, that's a great way to get noticed. Now, as a kid in school, I remember assistant principal called me in and said, Arthur, don't you realize that children aren't laughing with you? What are they doing? They're laughing at you. And given that I was a histrionic kid who liked being noticed, I thought to myself, yeah, what's your point here? Now, what's your guess? Am I an eldest child, middle child, or youngest child? How many think I'm and I'm not an only child. How many think I'm an eldest child? I'm sorry? Just one? You're it. How many think I'm a youngest child? 1, 2, 3, 4, 5, 6, 7, 8. It's all this side of the room. 9. How many think I'm a middle child? Well, that's the majority. Why? Because middle children, one of the issues you often see is it's hard to get noticed. So when Lindsay contacted me and said, would you be willing to come and speak to our group? You know, I emailed back and said, will there be people there? And she said, yes. I said, can I be the class clown? And she said, yes. I said, I'll be there. And the only thing that kept me away was 18 feet of snow. Otherwise, I would have been here. In Sweden and Norway, does anyone here of Swedish or Norwegian background? You. Where?
Background.
Goes way back.
Yeah.
I was lecturing in a room very much like this, very first time I went to Sweden. And I stopped and I said, any questions? No questions. Nobody asked questions there. I said, no questions, okay. And this went on for a couple of days, my first time in Sweden, and I thought none of them understands English. So all they hear is blah, 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 blah. They don't know what word I'm talking about. But during the coffee break, people come over and ask questions. So I spoke to my host, and I said, what's going on? And she said, well, we have some rules here. Synonyms, the state religion in Sweden and Norway is Lutheranism, and the basic tenet of Lutheranism is humility. So he wrote 10 new commandments. And we often think of Swedes and Norwegians as reticent. No, they have other commandments that most of us don't have. Thou shalt not presume thou art as good as us. You've got to keep your head down. Thou shalt not presume thou art more knowledgeable. If you ask a question in class in Sweden and Norway, you're showing off. And you're putting the professor down. So you're saying the professor wasn't clear enough. So you have to ask for more clarity. So as a group, they are generally more reticent. Has that been your experience? Does that explain your whole life? Yeah. And you had to come here to find out. But this is very common. So when I lecture in Norway or Sweden, not Denmark, they're different, I always start the same way. I'm very happy to be here in Oslo. I have an announcement before I begin. From my hotel room this morning, I spoke to the king, and he told me to welcome you in his name, and to tell you that for the length of my lecture, Janteloven is put aside, and you are to ask questions. And they always laugh. And they say to me, how do you know about this? It's a cultural rule. It's a cultural schema that's not shared. We know it, but we don't talk about it. But now you know the name of it. Now, do New Yorkers share these Scandinavian rules? Hide your head. Now, there are parts of New York, the Bronx, Staten Island, where Scandinavian rules are more prevalent. No. You're from the Bronx, you stand up, you stand from the Bronx. Some of you may remember that. It's a New Yorker's view of the United States. Talk about narcissistic. Here's 9th Avenue, Jersey, and out here somewhere, there's Chicago, it's a lump, and then the Pacific. So, are New Yorkers narcissistic? Yeah. Do we think we're special? And old Blue Eyes, he told us, if you can make it in New York, what? You can make it anywhere. So yeah, New Yorkers as a culture are narcissistic. We're raised to think we're special. I can skip that. Give you an example. I had a guy came in to see me, 48 years old, MBA from Wharton, lived in an expensive, exclusive suburb of Chicago. He was a vice president for a large multinational company outside of Chicago. And the mistake he made, they offered him a promotion. In a large corporation, if you turn down a promotion, they don't say, well, just hang out a while, we'll have something better. If you turn down a promotion, you have to leave. You don't get a second chance. And he was very depressed because he made a mistake. He turned down the promotion. He was making $450,000 a year. You know how many workshops I have to do? And the new job paid about $750 to be the CEO of their multinational in Canada. Why did he turn it down?
He didn't want to go to Canada.
Not that he didn't want to go to Canada, but he said, I said, why did you turn that down? He said, Canada? You know how many people there are in Canada? 35 million. Why couldn't they give me China or India? Even Italy has more people than Canada. So the idea of being CEO in Canada was so offensive to him that he has to leave his job. Everything was on the line. And I said, well, is there any way to recover? He said, no. I said, well, what made you turn it down? And he said, Canada. I said, but think of how good it could have been. Your family wouldn't have to learn a new language. He says, it doesn't matter. It was Canada. They often will join special groups. They seek kindred spirits, where there's a mutual admiration society, that they should only have to relate to special people. They belong to the special church. They belong to the special country club, and are very conscious of the external trappings. Group narcissism is very common. There's political narcissism. You know, we're either Republican with Democrats, with Tea Party. Religious narcissism. Our religion is better than your religion. National narcissism. Or even geographic narcissism. Narcissistic parents want narcissistic children. So they don't even try to rein the kid in. When the kid comes up with something unrealistic, they say, well, you can do it. I had an 11-year-old referred. The question was he on the spectrum? And the answer, I think, was yes. And the school had a problem with his vocational goals at age 11. He wanted to be a professional baseball manager. He didn't need to go to school. I read everything there is to know about baseball. So why shouldn't I be a manager? You know, he never played the sport, didn't know how to catch, throw, ground, but he knows all the rules, and that should be enough. And the parents never said to him, you know, that may not be realistic, honey. Are there other possibilities? We don't want to make him feel bad. We don't want to shake his world. Okay, I've already said that. We can also look at narcissism using the model we use for looking at children as internalizing or externalizing narcissism. Is it focused intrapersonally or is it interpersonal? The intrapersonal or internalizing narcissist has their belief systems and often ends up very isolated. But it's important because it'll help us structure our therapy. Freud's, one of his earliest and most important papers on narcissism in 1914 was important because the idea of ego-ideal and superego were developed. Now the idea of ego-ideal is really important for us because one of the things that we want to ask the patient, and we don't have to use these terms necessarily, but what is their ego ideal? What is their, because the ego ideal is composed of schema. What is it you see for yourself? What are your goals in life? And you're very fortunate here in New York to have someone like Bob Leahy, who has broken all kinds of rules by using the language and constructs of them and applying them in CBT, which I think was great. Now, Freud and the early analysts saw the narcissism as transitional. But for many narcissists, it doesn't transition. This is who they are. Let me skip this. So the narcissist spends a huge amount of time looking for acknowledgement of their specialness. And it leaves them empty, exhausted, and often depressed. When the desired positive reaction from others are received, I feel great. But then it goes away, and I need another fix. And there's a letdown resembling depression. And then they have to go back into a drive state to reacquire what they feel they've lost. The view of others that they are truly special. Now, one way to differentiate that the narcissistic loss from depression, the depressive has little energy to ease their losses, and they suffer silently. The narcissist often exhibits incredible energy to reestablish their specialness. So they get the energy somewhere. It's unusual to get someone coming in and saying, I'm a narcissist and I'd like to stop. They come in because their boss has said to them, nobody here wants to work with you. You're a jerk. Or a spouse has said, if you don't change, we're leaving. Had a fellow come into my office, this was when I was at Penn, and offices were furnished with old furniture, let me put it that way. University modern. And, you know, metal desks, things like that. And he walked into my office and said, for what I'm paying you, I would assume you'd have a much nicer office. Now, why is he coming to see me? Because his wife said he had to. He's driving a car that he can't afford. Because it's important for his business to look good. And the reason he's coming to therapy is he wants to hire me as a consultant to make his accounting practice more successful. So in gathering information, I say, do you ever go out, you know, take clients out to lunch? And he looked at me and says, what for? Why would I want to have a meal with them? Problem was when he became homicidal. He bought the biggest Mercedes they make. The real big Mercedes. In those days it was something like $75,000. And he would drive around the neighborhood. Hi, neighbor. People out in front of their houses, very nice neighborhood. He'd say hello to all his neighbors. What was he doing? Showing off his Mercedes. And he came in one day and he was furious and borderline homicidal. One of his neighbors, that son of a bitch, that bastard, bought a Bentley. You know what color? Gold. And you know what this guy would do? He'd ride around the neighborhood waving. So my patient talked about how he was going to kill the guy. He was going to park his car in the driveway, rear end facing the street, and have the engine on, car in reverse, and when this guy came abreast of his driveway, floor it. And he would back into the driver's side door and kill this guy. And then say, terrible accident. I meant to go for the brake and I hit the gas. So what do you do in a situation like that? What's our responsibility? I'm saying?
Hospitalized.
And hospitalize him for what? but driving his Mercedes? He said, they'll never convict me. I'll get a good lawyer and it's an accident. I said, I already put it in my notes. So I know it won't be an accident. He said, what I tell you is confidential. No. Not if you're a danger to yourself or others. So you would turn me in? Yes. So you've got to find an alternate way of dealing with this. But he was ready to kill someone who was making him look less good. One of the problems we have, the only place to find a pure narcissistic personality is in the pages of DSM or ICD. They don't exist in the real world. So what I'm going to suggest is that we don't even use the term. We have to. But to think of the patient as having an arousal spectrum disorder. Because while narcissism may be the major piece, they usually have pieces of a little bit of histrionic, little bit of antisocial, little bit of borderline. So to think of them as arousal spectrum. So all the cluster B criteria combine to form this disorder. And the best way to look at it, because many of the cluster B disorders have similar criteria. Put them all down and then rank them for that patient so you know where to start. Assess the component parts in order of severity, availability for change, or the client's motivation to change. Let's see. Probably the major issue in terms of diagnosis is that the problems are what our colleagues call egosyntonic. They're self-consonant. They don't have a problem being this way. This is a good way to be. I'm special. What's wrong with being special? In the words of the immortal Popeye, I am what I am. Okay. They're dramatic, emotional, or erratic. They relate to the world through these lenses. But the key for us, from a CBT perspective, we hear a cognition or behavior, we need to immediately think of what schema. So here's the behavior, what schema get us to that point? Or they give us a schema. And the question is, what diagnosis would you come up with for that schema? So when I told you about the woman calling me with these questions, I don't think many of you had a question about what her diagnosis was. We had examples of her behavior, and you had ideas for a schema, which she then made clear. I'm smarter than most people. I need a therapist that's smarter than most people. Or if you're told a diagnosis, it may be self-perpetuating that we know what schema to expect. But the key ingredient for therapy is understanding the schema. So there are four things that I need to look at. Temperament, what we call genotype, behavior, the phenotype, the environmental context, the term I use here is sociotype, and the personality pattern and style, which I'm going to label schema type. What are the basic schema for that individual? This is just DSM stuff. One of the problems with DSM generally, I won't spend much time on this point, is that no matter how clear they try to make it, it's still incredibly unclear. Terms like higher than average, ideal, special, envious, arrogant, what does that mean? We really don't have good operational definitions. In fact, some descriptors are so vague as to be unusable. What we find is that for the arousal spectrum disorders, they're generally true to their cluster. You don't find, well, he's a little bit schizotypal and a little bit borderline and a little bit dependent. No, most of us are generally true to our schema. There's a great scene from Alice in Wonderland. She reaches the fork in the road, there's a tree there, and in the tree is the Cheshire Cat. And she stands and says, "Oh my, which way to go?" And the cat says, "Where do you want to get to?" And she says, "I don't know." And the cat says, "When you're not sure where you're going, any road may get you there." Conceptually, we've got to be very focused. We can't take a round, circuitous, wandering, free associative approach. We've got to be much more focused in what we do. And we have to understand narcissism is not a unitary phenomenon. It has many manifestations, and these expressions of the narcissistic style may be combined to form a complex pattern. So here's what I see as the range of narcissism. And this is not in any order or priority or hierarchy. Number one is positive self-esteem. The individual views themselves generally in a positive way. So if you say to Michael Jordan, "Were you a great basketball player?" what would Jordan probably say to you? "Yeah, I was." He wouldn't say, "Was I great? I was the greatest." Now, some people say he was the greatest of all time. But he'd say, "Yeah, I was pretty good. Yeah, I was very good." There's healthy narcissism. We recognize that we're good at something, but we don't flaunt it. We don't walk around rubbing people's noses in it. There's group narcissism I mentioned earlier. The problem with group narcissism is your special status is lost when you leave that group. There's what I call helpful narcissism. This is usually your mother-in-law. She comes to visit and is not loath to tell you how to be a better housekeeper, better parent, better cook, better wife, better father, so that you say, "I'm really tired." "Honey, I'm just trying to be helpful." And they really are. But what we recognize is they believe that they are the best. There's real narcissism. These are the individuals who go around rubbing everyone's nose in it. That I'm better, I'm smarter, I'm bigger, I'm stronger. Compensated narcissism, where the whole self is blown up. The vengeful narcissist, they spend their time getting even for real or imagined slights. Example, I was seeing a man for therapy and he came and he said, "I don't know what to do about this, I don't know what to do about this." What happened? He got a new boss. New guy was hired. And his boss invited this fellow and his wife to dinner. And the boss bought a gorgeous house, sterling silver flatware, crystal, beautiful dishes, and someone to serve the meal. And he said, and the meal was excellent. I said, "Well, sounds great." He said, "No." On the way home, His wife was furious. They were just showing off. They wanted to show that they have what we don't. They were just rubbing our nose in it. But I fixed them. He said, what did you do? And she opens her purse and takes out a salad fork. She said, they used to have service for 12. She says, what do I do? The boss's wife called and said, did you by accident, did it fall in your cuff? How dare you intimate that I stole it? Which of course you did. But that would be the vengeful narcissist. They're going to get even. Now, can that salad fork be replaced? What do you think? Of course. If you have all that money, you can get a new salad fork. But that would be the vengeful narcissist. You got a problem? You got a problem with me? You don't like it, you can get that. The paranoid narcissist is constantly scanning for data that challenges their high regard for themselves. The violent narcissist will use anger, threats, menacing gestures or words, intimidation, expressions of violence. And the psychotic narcissist loses reality. Who is the fellow who tried to assassinate Reagan? John Hinckley?
Yeah.
And why did he want to kill the president? Because Jodie Foster would then fall in love with him. He was that special. Jodie Foster makes a practice of being attracted to violent, psychotic narcissists. I don't know. Had a call. A woman said, I'd like to make an appointment for my son. Okay. I get parents of adolescents calling. I said, how old is your son? She said, 52. I said, have your son call me. No, he's under a lot of pressure. He's very depressed. He's very depressed. It's a guy who graduated from Penn when he was 22. For the last 30 years, he's lived at home. Dad was a cardiothoracic surgeon, made a lot of money, left him a lot of money, and he doesn't do anything. He's retired, the son. So I said, no, I won't make an appointment. Your son has to call me. A couple of minutes later, yeah. I said, who's this? My mother told me to call you. Okay. When should I come in? He said, we'll have an opening Wednesday at 3. And he hangs up. We're done. He comes in with his mother, and she has a file about 3 inches thick. And she hands it to me. I said, what is this? She said, these are copies of reports from previous therapists. And they all end the same way. Untreatable. Non-compliant. And they had taken him to therapists from Boston to Washington. He had seen every major psychiatrist, psychologist in that corridor. Many people who taught me. And he's sitting there. Now, the way my office was set up, I had the patient chair on the side, and across I had 2 chairs in case a crowd came in. Where does mom sit? Any guess? In the patient chair. And he's sitting across the desk. And when I asked him a question, what happens? She answers. Please don't put pressure on him. He's so depressed. He's been depressed for years. I looked at all these reports. I said, now, medication was prescribed for your depression. Have you ever taken it? Mom says, I'll take it for a couple of days. It doesn't work, so he stops. And it's not going to go anywhere. So I said, you've seen a lot of therapists, haven't you? And all the reports say that you haven't been helped. And for the first time he looked up, made eye contact with me and said, do you think you can help me? Does that sound like a request for help? It's a challenge. So what do you say to that? I said, no. No. You've seen all these great therapists, some of them my teachers, and if these great therapists couldn't help you, I certainly can't. And somebody says, well, you're not going to even try. I said, no. That's unethical. You can't do that. I said, yes, I can. In fact, the code of ethics in psychology says that if I don't think I can help someone, I shouldn't see them. And I don't think I can help you. And his mother was crying, please, Dr. Freeman, please. And he's yelling at me. How do I dare not see him? He is what I call the helpless narcissist, the yes but patient. They often come for therapy with refractory depression, low self-esteem. But the problem is not their depression. The problem is their narcissism. Typical schema for this individual: if I surrender my symptoms, I'll be like everyone else. If I appear weak and helpless, a strong person will appear. I am special. My weekly meeting with my special therapist proves that. Some of the best known therapists in this area have failed to cure me. I always win. So that rather than treating him as depressed, I treated him as a narcissist. Then I said, I will see you for 5 sessions. We'll set some goals for those 5 sessions, and if you don't meet the goals, we stop. He said, that's not the way therapy is done. Okay, then I won't see you at all. You have 2 choices, one to do it my way, or the other is to put a sharp stick in your eye. Which would you prefer? I didn't say it just that way. So I saw him for about 6 months in 5 session modules. And finally he said, I'm not going to do any more. I said, that's fine. My mother wants to know if you'll give her a report for the next therapist. Very often they're on SSI, and the reason you can't help them is because we're treating the wrong problem. This is a review. Now, when we challenge schema, anxiety is going to result. So when we challenge their view of themselves, their world in the future, what Beck called the cognitive triad, they can become very anxious. So the first thing I want to do with narcissists is teach them anxiety reduction techniques. So when they start to get upset, they're able to stay in therapy. But we're going to have to work on the schema. And there are 5 possibilities. Some individuals have schematic paralysis. Their view of themselves is ossified, and nothing you do will bring about change. They're stuck. For others, I call schematic rigidity. They're very dogmatic. Change may come, but it's going to be pulling teeth. For most of us, we live in here. We know what the schema are. The internal rules are clear and predictable. And we know what to expect. Schematic flexibility is a key ingredient in creativity because they believe rules can be bent or changed as needed. Here, at the other end of the continuum, what I call schematic instability, their schema are chaotic. You know, I feel so isolated and alone. I'd love to be close to someone so I can feel secure. When I get too close to you, I feel vulnerable, so I have to move away. But then I feel isolated and alone. So I never know what schema to follow. I don't have time for this. But this is something we're developing. We're developing a questionnaire for this, looking at 3 elements for change: motivation, skills and abilities, and systemic or situational support. Now, whether or not you need an equal amount of each one, or one can compensate for others, we have yet to see in our research. Okay. Now, magically, I gave a DVD to God. And if I speak to God, she will answer me. God, can you put on the DVD, please? Don't mess.
Hello. Please have a seat. Well, thank you for being here. I appreciate that. Tell me your name again.
Thank you, God.
Okay. May I call you Alfred? You may call me. Thank you. As we speak, I'm going to take notes, just to help me remember things. So, that'll be here. Maybe a good place for us to begin is, why are you here? What brings you in here?
Yeah, I think a lot of things. In the first place, in the last few months I'm trying to rearrange my life again. I'm living alone now after a relationship of 4 years. We broke up 5 months ago. My girlfriend has left me, and she only left one note explaining just a few things, and I still don't understand why she left me.
Okay.
It's not the first time that a relationship and then broke up very suddenly. So I'm starting to wonder. Will I ever be capable to live to be in a relationship again? For me, I know for sure I'm not capable of living alone.
Can we hold that?
No.
So what we hear immediately are very dependent schema. I'm not capable of living alone. My relationships, they keep running away. So my first thought is, oh, this guy sounds really dependent. Okay, let's move on.
For a long time.
So your idea is, I can't live alone,
Yes.
but the question you have is, am I capable of
Yes.
having a relationship?
Yes, because it's the 3rd time I've been the woman I love the most runs away from me.
Can we hold it? When do you run? I'm sorry? Fight or flight, but when do you run?
When you're scared.
When you're scared. You know, do we run because we're scared, or we're scared because we run? But when you run, I mean, these women don't just leave him. It doesn't even say abandon him. They run from him. Okay? Let's move on.
When it happened the first time,
Yes,
did you wonder at that point what was going on?
yes.
But you got no answer.
Not really. No real answer.
When it happened the second time,
Yes,
you wondered again,
yes.
but no answer.
No answer.
And now it's a third time,
Yes,
no answer.
no answer.
So one of the things that it sounds like you want to do is see if you can find an answer to why this happens to us.
Yes.
Problemless.
Sometimes I understand that I have some influence of people. Sometimes people seem to be scared of me, and I don't know why they are scared of me.
But people are scared.
I hold it. Is anyone scared of Alfred? You scared of him at all? No? Okay, just curious. No, no one's scared of him. Poor guy. A little bit scared of him? Okay, let's continue.
Maybe we can come back to that in just a bit. Aside from the relationship problems, are there other reasons that bring you to therapy at this point?
I think that's the main problem, because if I don't get an answer, I don't see how I will live my life.
You may be suicidal.
Because I'm not. I've been living with my sister for 2 months because I couldn't stand to live alone after my girlfriend left, and in the last few months my sister convinced me of getting some help, because I didn't see any future for myself.
Hopelessness, a key ingredient.
I've been thinking about maybe I'll be better off when I finish it all.
When you kill yourself?
Yes.
Is that something that's very active for you, thinking of killing yourself?
At the moment, I will try to give myself another chance. At this moment, if it doesn't work out, then it's an option for me.
It's an option.
Yes.
When the first relationship broke up,
Yes.
did you think of ending it at that point? Killing yourself?
Yes. I had a short period that I didn't know what to do.
But did you think to yourself after the first relationship ended, maybe I'd be better off dead?
Yes, I thought about that.
Okay. When the second relationship ended, did you think of killing yourself then too?
Yes, but I also had thoughts of killing her, because...
Can you stop? I'm sorry, I missed that. What did he say? He had thoughts of killing her. Let me ask again. Anybody scared of this guy? Now he becomes very spooky. Is thought of killing his girlfriend something you typically find in a dependent individual? No. They'll do anything they can do to keep them. And I heard him say this, and I went, oh my God. But, you know, I can identify with that. I have empathy. Because when my wife left me, she took my truck and my dog and my guitar and ended a very successful country and western career. You don't believe that, do you? But I would never think of killing her, the mother of my children. We loved each other so much. We looked so beautiful at the wedding. How could I kill her? But Alfred thought of killing her. Let's continue.
Brilliant. But I could control myself. I left her alone.
He was a hero in his view.
So, one issue is that when you lose a relationship,
Yes.
you get very angry, you get very sad.
Yes.
And one thought you have is, I might as well kill myself. That's one possibility.
Yes. Yes.
But you didn't kill yourself after the first.
No.
You didn't kill yourself after the second.
No.
But now you're having that thought again.
Yes. It's the third time.
Third time. How many times are you giving yourself? Are you saying 4 times and that's it? Or are you giving yourself a limit on the number of times that you'd have relationships?
No. In the last few weeks and months, I'm not seeing anyone. I'm not even trying to get acquainted with people.
Okay. Let me gather some information, Alfred, just so I get to know you better. You're how old?
I'm 40.
You're
40 years old.
Okay.
Can we hold it? He's a university graduate. He's employed as the night manager of a hotel in downtown Amsterdam. He doesn't see anybody. The only time he'd see people would be a late check-in, or if you need batteries for the TV remote. Otherwise, he would sit in his office behind the front desk, phone calls to his girlfriend 15, 17 times a night. And her job was to wait up for his phone calls, because he'd sleep during the day. Okay.
You have a sister.
Yes.
Is she older or younger?
She's older.
She's an older sister. Are your folks around?
My
Your folks
parents,
still alive?
my parents
Okay.
are still alive, yes.
Okay. And what do they do? What does your father do?
My father,
How does he work? Does he work?
yes, he works as an insurance agent.
And how old is he?
My father is 73.
And your mother?
My mother is 69.
And what does she do?
She doesn't do anything.
I'd hold it. So his mother must be severely debilitated, maybe some neuromuscular problem, because she doesn't do anything. Of course, it may be his schema about women. Let's continue.
Nothing at all?
Nothing at all. No.
Does she cook or work at home?
Oh, yes. That's what helps.
So she does things.
Well, we begin to see his schema
But
about
she
women,
doesn't work outside the house.
their value, or lack thereof.
When you were a teenager,
Yes.
did you date? Did you go out with girls?
Yes.
Did you have relationships?
I wasn't a very popular teenager at the time, when I was a teenager.
Why not?
I don't know. I'd rather spend time alone. I was, in a way, I was alone. But it didn't worry me. It was no problem for me.
Wasn't a problem.
No.
But you did have dates.
Yes.
Did you have a regular girlfriend?
No, not really a regular girlfriend. There was a girl next door with whom I grew up a little bit, and she was the closest.
When was the first time, how old were you, when you started dating someone as a special person?
I was 22, 23.
Okay, can we hold it?
So at 22,
Now, I didn't know what the culture, this was done in the Netherlands. Maybe, you don't start dating till 23, 24. And they said, no, 13, 14, just like in the US. So he's 10 years behind the curve of having a real girlfriend. And listen carefully to the women he picks. Let's continue.
23. And what was her name?
Anna.
Anna. How long did you go out with Anna?
About 6 months, 7 months.
And why did that relationship end? What happened to make it end?
Yes. Yeah, I remember she felt she was only 18 and she felt too young to be in a steady relationship.
Okay.
For me, she was I was prepared to ask her to marry me.
Well, I'm finished with dating, so I'm done.
But she wasn't. She wasn't like.
She wasn't ready.
No, she wasn't ready.
And after Anna,
Yeah.
who was there? How old
A
were you?
very long time there was no one, because I was very disappointed in girls, and I didn't have the courage to start a new relationship.
So the next relationship was when?
A real relationship, because I dated other girls, but they were just
More casual?
Yes. And the
The
first
next real relationship. You stopped seeing Anna when you were about 23.
yeah,
How old were you in the next real
I
relationship?
think I was 30.
Okay, let's hold it here.
And,
Now, how do we explain that 7 years to the next girlfriend. How would you explain that?
Fear of rejection.
Okay. Good, good. What else?
Waiting for one who's good enough.
Waiting for someone good enough? Now, what's a very convenient, and again, I thank Bob Leahy for doing things like this. It was a very interesting psychoanalytic idea. It's called the narcissistic injury, or the narcissistic insult. She did what? Took him 7 years to get back up on that horse. And that would be an example of the narcissistic injury. How could they do this to me? So it's a very useful idea. Let's continue.
And I've had a steady relationship for all those years.
And what was her name?
Her name was Carla.
And how long did you go out with Carla?
About 2 years, I think. Yes, 2 years.
And she ended that.
She ended
But she didn't say why?
it. She did say
Oh, she did.
no, she said she thought I was too possessive and I was trying to fill in her thoughts. She felt that she didn't feel free with me because I think she was only scared of my love.
This is how he sees
A
it.
very intense feeling for her, and that scared her a little bit.
She saw your intense love as being very possessive.
Yes, that's how she mentioned it.
Okay. Did you live with Carla? Or
We lived 1 year together.
1
We
year.
saw each other 1 year and we lived 1 year together.
Okay. So you stopped seeing Carla, you were about 32.
Yeah.
Then, who was next? Who was the next woman?
Saskia,
And how old were you then?
I was Saskia, it's Saskia. I was 45.
35.
30.
He was counting in Dutch.
And how long were you with Saskia?
I've been with her for 4 years. She's the girl who left me 5 months ago.
Okay. And you lived with her?
We've been, from the first day we met, we didn't separate after.
Hold it.
After.
They met, and that day she moved in with him. Now, what kind of schema does she evidence? Very dependent. And the people, the kind of woman that Alfred would be attracted to would be someone very dependent who would take his great love or control, as Carl called it. Okay.
Speaking
So you're with her for all this time.
all this time.
What did she say? Did she say to you anything like Carla said to you, that
No.
you were too possessive?
No. Afterwards, I hear some things because 5 months ago we went into therapy together because she was very insecure and at one point she said she was thinking about leaving me, and when she saw how upset I was, she was giving us and our relationship another chance, and she made a condition. Okay, I will stay, then we go in therapy. And we had a few sessions in therapy, and then the therapists, in my opinion, forced her to break our relationship up.
Hold it. Do therapists do that? The therapist force someone to break a relationship? Yeah, we do. Under what condition?
Dangerous.
What's that?
Dangerous.
If you as a therapist say to yourself, or say to Saskia, if you stay with him, he may kill you. Now, the therapist didn't know anything about his threat against Carla, but he'll tell you what he did with Saska. And the therapist, when he was at work, had her move out into an abused women's shelter and refused to give him her location. And he screamed, and he came into her office, kicking furniture around. He says, you know, I never kicked any furniture towards her. So I don't know what she was scared about. Okay.
Let me come back, Alfred, to something you said, that something about people being scared of you.
Yes.
Scared in what way?
Sometimes it's when I trust people and they do something. They treat me nice in my face and when I turn my back. They don't treat me nice. They talk about me. That makes me very angry. And sometimes I know what I know about myself. So when I'm very angry, sometimes it's hard for me to control myself.
But you say people are scared of you.
It's,
Do you become so angry that you hurt people?
It's a very simple question, Alfred. Yes or no?
Physically?
physically.
Yes or no?
There's been some. Yeah.
Look at the latency.
fights.
We meaning who?
Just,
Okay. How about with Carla? Did you fight with Carla too?
just verbal fights.
Just verbal fights.
Yes.
Sc.D was scared of you. Is that right?
Yeah.
You were physical with her?
Yes or no?
Sometimes there were some moments. And we had it was not really a fight, but I held her so closely that she felt me. That was at the end of our relationship, and it was just a little incident, but the therapist used it as they made a big issue out of it.
Made a big deal.
Yes.
Okay, let's hold.
We,
So you get an idea. He's physically violent. Is anyone not scared of him? Now, what I didn't know at this time, and I didn't find out till the second session, is his girlfriend, Saska, was pregnant. And maybe I'm an old-fashioned kind of guy. Throwing your pregnant girlfriend to the floor is not nice. That's just the kind of guy I am. But he has no problem doing that. He knew she was pregnant. And it's why the therapist said, you better get out of there. The video goes on, and we don't have time for all of it. Can I get back to the slides, please? let me finish this, and then we'll have time for questions. So with Alfred, getting him to learn empathy, caring, being assertive rather than aggressive, looking at consequences, self-regulation, being proactive, not always reactive, building skills. Now the typical narcissistic pattern is there's a stimulus and we respond. The ideal pattern is there's a stimulus and a response. But the more of these pieces we can interpose, the better functioning we're going to get. The use of mindfulness, being aware of what you're experiencing, being aware of what's around you, recognizing the schema, problem solving, what am I going to do about this? Making a decision and then responding. Alfred goes from here to here. I was asking her a question, she wouldn't give me an answer, so I threw it to the floor. If he stopped for a moment, She might still be there. And later in the session, I asked him about that. And he is unyielding about that. I said, you know, how much of your love would you have to dial back? He said, how much love would Saska be able to take? And he said 65%. I said, would you be willing to dial back to 65%? He said, no. I want to know why she doesn't want 100%. Well, maybe she's scared. She needs to take 100. Okay. Basically, we're dealing with very narrow schema, or very limited schema. Ideally, what we have to think about is enlarging the schema, giving him more room within which to move. So I want to cover one more thing. Patient comes in, we say, here's what you look like. But after cognitive therapy, boy, are you going to look different. It's not what happens. With the narcissist, if we can knock the sharp corners off so they're easier to live with, we'll have done them a huge favor. Now the question we have is, how are we going to do that? And the easiest way to show that is how severe is the problem. The greater the severity, the greater the preponderance of behavioral work. The less severe, the greater the preponderance of cognitive work. So with Alfred, what are we going to be doing? More cognitive or more behavioral? More behavioral. He's bright, he's articulate, but I wouldn't want to do that. Now again, never goes down to zero. But most of what I'm going to do with Alfred is working on behavioral interventions. Okay? What we want to do is set out a problem list. What patients come in with are lists of complaints, not problems. So our first job is to turn these complaints into a problem list and then figure out how we're going to help them reduce that problem list. I can go on for another several hours, but people are yawning, so take that as a subtle cue. And Lindsay told me I only had an hour and a half, and then we'll have time for questions. So I've done an hour and 29 minutes. I don't want to push you. So I'm going to stop here and ask if there are any questions. You had a question, sir.
Can you describe why not antisocial personality disorder?
With Alfred?
Yeah.
I don't, well, he doesn't fully meet criteria for any of these. I'm going to, again, I want to cop out and say arousal spectrum. He's got antisocial features. He's got borderline features. Most of what he has is his narcissistic features. You must take everything I give you. So I think that's the major element, though I think there are elements of all the others. Yes?
I was just wondering if Tourette's.
A little louder.
I was wondering if Tourette's was ever considered with him, with his tics and that sort of thing, and his propensity for anger and that sort of thing. So that would be part of the mix.
There was no, now let me tell you, Alfred's not a patient, he's a professional actor. You know that.
I heard you say that before.
Yeah, that the hospital uses a simulated patient process, that they train this professional actor to play various diagnoses to train the psychiatric residents. He's very good. He watched videos of the real Alfred, and there was no evidence of any neurological issues. I think the tics, the movements, are much more psychogenic than neurogenic. Questions, comment? Yes, sir.
I wonder if you might have any examples that come to mind of behavioral interventions you might use in treating, if you were to treat a patient like Alfred.
I'd like to find a DBT group for him, because the DBT group is skills focused. How many friends does he have? How many human contacts does he have? None. And he says he doesn't much care for them. I'd like to see him in a group that can give him some support, because he has no support other than his sister. In the second session, he tells me that his sister has thrown him out. That he was living with his sister, her 2 children, and her husband, and coming home one night drunk, he fell down the stairs in our home. Woke up the kids, woke up his sister and brother-in-law. His brother-in-law said, "You're a drunk, I don't want you in the house." The kids are crying, and he says, "You promised I could stay here." The brother-in-law said, "Give me the key. I don't want you here." And he was very indignant in the session. I says, "Let me see if I can get this clear. Your sister is more concerned about her children than about you." And he said, "Exactly." But why would we be surprised? He said, "She promised me I could stay here. And now she's more concerned about her precious family than me." And the second session, I asked him, I said, "If you met another woman tomorrow, would you still be suicidal over Saska?" And he said, "No." And I must admit, where I got that idea was from an old song that you probably all sang at camp. "Oh, my darling Clementine, how I missed her, how I missed her, how I missed my Clementine, how I missed her, I met her sister, I don't miss my Clementine." So if he met another woman tomorrow, he'd be as good as could be, as long as she'd take. Now, we put him on eHarmony or Match.com or DD, Dutch date. We put him on some website, a narcissistic 40-year-old, university graduate, very controlling and demanding, would like women, willing to accept all of his loving control. Do you think there are any women who would answer that ad? Yes or no?
Yes.
No? I got a shiny nickel, I'll bet the whole thing that there'd be people who would respond to that. You probably have them in your practice now. Questions? 1, 2.
Yeah, what do you do about the highly financially successful narcissist who...
Highly successful.
Financially speaking, narcissist, because the problem is, or one of the problems is that, people have to be nice to him in his work environment because he is the
Yes.
boss, and he can manipulate people through his finances.
And why do we want to change that?
Because his family is miserable.
He has a choice. But the question is, what's his motivation to change it? I did a series of workshops many years ago, and I called it's for executives like that. It's called Changing What You Do Without Changing Who You Are. They don't want to change who they are. I'm successful because of what I do. Now you want me to be just like any jerk. I don't want to be that. So the biggest issue we have with that individual is how to make a small change to knock off one of those corners and see what effect it has. It's really therapeutic experiments. Yes, sir.
I was wondering if you could...
Nice and loud, the old man's deaf.
Sorry, I was wondering if you could talk a little bit more about ego ideal and its kind of role in the etiology of narcissism or in narcissistic disorders and the source of like this kind of rigidity that we're talking about.
We all build an ego ideal, you know, what we want to look like. The first course I took in graduate school at NYU in 1964, the instructor teaching the course was a fellow by the name of Claude Grant, visiting professor from Utah. Remember him? He would wear tweed jackets, button-down collar shirts, striped ties. Funny. And he, you know, had crew cut, which was appropriate in those days. And I thought, boy, if I ever become a psychologist, that's what I want to look like. And I've got tweed jackets. The only difference is I can never do the patches. I used to have patches on the elbows. We all build this ego ideal. The narcissist builds an ego ideal like everybody else. But in it, they're the center of attraction. Family therapist, Florence, her daughter was president of APA. I don't remember. She does an interesting thing. She does what she calls a projective genogram. She says, draw a picture of your family structure. And she wants to see where they start. Do they start, you know, grandparents, parents, or do they start with themselves? Narcissists generally start with themselves, and the world kind of circles around them. So I will ask, you know, what is your ideal of the perfect life? And you had started asking about this guy in Forest Hills, in the big white house. He has an idea of a perfect life, where he has the best, the most, the biggest of everything. And anything that is at variance with that idea is unacceptable. And he surrounds himself with people who say, yes, Spike, you're the best. Yes, Spike, you're the best. And they are until somebody else becomes the bestest best. Questions, comment? Yes?
You mentioned sometimes referring someone with narcissistic personality disorder to groups. When would it be indicated? How do you manage them within the group setting if there's other people with different diagnoses?
There are a couple of people I wouldn't put in groups. Narcissists, I generally would not, because they tend to overwhelm the group, intimidate the group. Yalom, for example, will not put suicidal patients in a group because he says their suicidality itself is so self-focused, so narcissistic, they suck the air out of the group. They take all the energy out of the group. So I'm not real keen to put narcissists in groups, even with other narcissists.
This guy, Alfred, was an interesting patient. Would you mind outlining it sort of in a nutshell, how the treatment with him concluded and what kind of clinical techniques, cognitive or behavioral?
It never concluded because Alfred was an exemplar. I saw him twice. He was seen by a number of therapists. So he was interviewed by Marsha Linehan, by Kernberg, by a number of, mostly psychoanalysts, Lorna Smith Benjamin. So a number of people interviewed him, and he always, as an actor, gave us a fresh patient.
Oh, I thought he was a patient initially.
Yeah, and I don't know what the outcome was with the real Alfred. They never gave me that. They never told me.
So in terms of interventions, would you just name a couple that you would have thrown at this
With the real Alfred, they didn't do anything behavioral. Because the hospital, the director of the hospital was president of the Dutch Psychoanalytic Association. So everything they did was psychoanalytic. What I would have done is asked a very simple question. Would you like to get more of what you want? Because they go through life, people trying to knock them down a peg or two. So I say, you know, I'd like to help you get more of what you want. Would that be okay with you? Example. Had a patient come in. He was referred by the Federal Probation Office. Requirements were that he had to come in once a week for a year as a condition of his probation. And he walked into the office with 5 minutes left in the session. And he said, "Hey doc, how are you? Just checking in. I'll see you in a year." No. That's not the deal. You have to come in every week. They don't make you do that, and he tried to convince me that making him come to therapy was a violation of the First, 9th, 93rd, 112th Amendments to the Constitution. I told him this may be true, and you know, being merely a psychologist and not a constitutional scholar, this will have to go to the Supreme Court. In the meantime, he has to go back to jail. Well, for the first 2 or 3 sessions, he didn't say a word. He just sat there and read either a magazine or a newspaper. So what am I going to do? So I thought, let me deal with him schematically, like I teach. So he came in and he sat down, took out a newspaper, and I said, you know, I was thinking about you over the week. That got his attention. And he looked up. I said, I was thinking how dumb you are. He said, I'd like a punch in the face. I said, oh, I don't want a punch in the face. But I was still thinking how dumb you are. I didn't say stupid. That's different than dumb. He said, what makes you so smart? I said, no. I didn't say I was smart. I said, you're dumb. He said, what makes me dumb? I said, I charge $100 an hour. You can see me for free. See those books on the shelf? Whose name is on all the books? Is that you? I said, yeah. So I'm an expert on changing behavior. Is there anyone's behavior you'd like to change? He says, you can change people's behavior? I said, yeah. Whose behavior you don't want to change? He said, my girlfriend. Okay. Tell me her name. And now he's giving me all kinds of data. He said, and what would you like to change? Well, she's a lazy bitch. Then what makes her a lazy bitch? Well, she never cooks, and she's not sexually available. Those are not his exact words, but, you know, she's not available. Can you make her? I said, yeah, of course. And he said, how are you going to do that? I said, well, let's, you know, how old is she? Do you ever hit her? Oh, no, I wouldn't do that. That's bad stuff. I don't do that. I said, do you insult her? He says, yeah, I call her a lazy bitch. Okay. Let's make out a plan. Do you ever buy her gifts? What do you mean? I said, presents. He said, you mean like birthday, Christmas? I said, yeah. No. I said, what would happen if you did? What for? It's a scientific experiment. What would she like? She loves flowers. All right. What would happen if you came home today with flowers for her? What would happen? He said, I don't know. I said, would you be willing to do an experiment? Okay. So I enlisted him as a co-scientist. Came in the next week, no magazine, no newspaper. I said, well, how did it go? He says, fucking fantastic. On his way home, he stole some flowers. He did. He said he was walking along by someone's home, and they had, you know, flowers by a fence line, And he just pulled out flowers, and he came home, and he said, here, for you. She said, what's this for? He said, I know you like flowers. Oh, honey. And they got smoochy, and she became available. And after she was finished being available, you know what she said to him? You hungry? I said, so what you doing? He says, so all I gotta do is be nice to her. Now you say, well, so you're making him a better psychopath. No, I'm making him like the rest of us. If you are nice to someone, they may reciprocate. And then I taught him how to get over on his parole as probation officer. You know how to get over on your probation officer? Show up on time. In fact, 10 minutes early. I know I'm early, just let you know, I'm out in the waiting room. And you only have to come every other week. So I could help him think of how not to piss people off. Because he was an interpersonal problem person. Say again?
Natural consequences.
Yeah. Anything else? Questions, comment? Contact Lindsay and she'll give you a copy of the slide set and all the things that we didn't have time for. If you're interested in the full video of Alfred, you can contact Victor Yalom at psychotherapy.net. And they've got 3 videos of Alfred, me, Marshall Linehan, and Otto Kernberg. It's really interesting to see the differences. Thank you very much for inviting me.
Hi everyone, I'm Lindsay Colchin. I'm the events chair for NYC CBT. I just want to thank you all for coming. Thank you so much to Dr. Art Freeman for this amazing presentation. Thanks to God, also known as Colin, back there for
Colin did it all.
So we have another talk coming up in October. John Kuchankis is going to be talking about CBT for LGBT community, helping with stigma. That's going to be super interesting. And just look out for our emails. We will send that out probably a little bit closer to the event because I know it's pretty early to think about October. And for those of you who aren't members, who are interested in becoming members, please visit our website. You can sign up through there. Obviously, you get a discounted price for admission here, and you have access to the listserv, and there's a lot of great opportunities for discussion. Yeah?
Not members, don't send them the slide set.
I do that.
Just to members.
There you go. So you can contact me if you want the slides. I think it might be easier. I could just send them out to whoever was registered. That way, we don't have to have like an individual back and forth.